It is.
Alex, go ahead.
You're gonna try and
Welcome to season 2, Blerd.Talk, episode 1. We're back. It's been a long time.
We're back.
Huh?
Yeah.
like a month and a half.
That's a long time. It's a long time.
It's a long time, man. I had hair before. Look at me now.
You mean your hairline is receding now, right?
No.
And welcome with our new guest today.
With that being said,
this is my significant other, and she will be joining us for this conversation.
And the conversation today,
yes,
it's not about my hairline.
How has COVID affected you this year? There's going to be plenty of ups and downs, obviously. Ghost Stanley.
Nah, Ghost Stanley doesn't want to go in this one.
All right, well, look. So, I'll tell you, so COVID has affected everyone differently, obviously. There's been ups and downs, been pros and cons. One of my good friends from work, he had caught COVID. He had died. That was obviously horrible, very emotional. It was unexpected. On the flip side, because of how the economy was, I mean, unemployment was very good to me. But the overlying thing was just that the fact that so many people have lost loved ones, families, friends, and that takes precedence over everything.
Yep.
I'm pretty sure Heather's been working in a hospital. You've probably seen more than we could ever see or experience so much more.
Yeah.
With my significant other being in a hospital in the same field, being exposed to that on a daily basis, well, I'm pretty sure it's pretty stressful all on its own.
Very. It's like now I'm in that phase where I worry about bringing it home. Because you got to think I'm around that stuff like a good 10 to 12 hours of the day. And then I got to come home and shower and all that. So it's like, granted, I worry about bringing other stuff from the hospital home, like C. diff, the flu and all that. But now I got to worry about COVID, which I made a joke. It's like the flu with extra steps. So it's a lot. A lot of people, especially in this country, they don't understand like what us healthcare workers are going through right now. Like, yeah, all the pizza parties and the signs that say heroes that work here. Yeah, that's great and all, but
yeah, like just
we need more than that.
The exposure.
Yeah.
I mean, you can have a pizza party all day, but I'm still being exposed. Like pizza don't hold a candle to that. Like
it doesn't cure COVID.
Exactly.
Yeah.
So
it's something to do to help, though. I mean, I think that should be acknowledged. It's better than nothing. No acknowledgement.
Yeah, I mean, you grow. I'm pretty sure in the healthcare field, you grow more appreciation for simple things like spending time with your loved ones and et cetera, et cetera. But something like COVID can just come and just boom like that. Like from what I was under the impression that when a person contracts COVID, they're locked in a room, like isolated, and it's like no contact in or out unless it's like doctors or nurses. So it's like, well, yeah, I'm saying, I'm just from what I was hearing, it's like that's a very scary thing. I would imagine for you not to have contact with whoever.
And having to say goodbye to your family like on an iPhone, like a video instead of physically being there, it's like the hardest, because when you watch your family member like actively dying, you want to be there to like hold their hand and say your last goodbyes and all that. So now during this, if you're if your person in your family or a friend is dying, it's like you can't physically be there. You have to look at it through a phone or an iPad, and to me that's a lot worse. That's a lot more damaging than actually being physically present with them. But being in a situation where I'm watching someone pass and it's like through an iPhone, I'm probably gonna act out a little bit more versus if I was physically there. Because at least if I'm physically there, I can watch them and in a sense touch them the last time. iPhone, you can't do that unless they come out with some kind of program where you can. But iPhones and iPads, it can't do that, and it's heartbreaking. It's terrible. And I've seen all ages catch COVID. I've seen a kid who was 7 that caught COVID. I've seen an elderly man who was like the same age as my grandfather to catch COVID. I've seen someone my age. I'm 26. I've seen someone who was 26 that caught COVID. So, like I tell everybody, I say COVID don't care who and what you are. It's gonna find you. Like it's gonna catch you and it's gonna find you. So that's why I usually just tell people, like, watch yourself, be careful. The whole, like, people call it social distancing. I call it melee range. So stay out of melee range. Just pretty much just be careful and watch yourself and make sure you're taking care of yourself and make sure your family and friends are being taken care of as well.
Yeah. It's just, I don't know. I don't know if y'all have looked into the news about vaccines. I mean, if y'all have I don't know if y'all want to touch that subject.
I mean, I have to get it, so yeah.
But I mean, I don't know if that's something that y'all want to make a point on, or if you
ain't touching it.
I guess the question is, who here will willingly get the vaccine?
Well, I'm excluded because I have to.
If you don't have to, if you have a choice, will you get the vaccine? Day one vaccine launches 12/8/2020. That's a no.
20,
That's a no.
21, 22, 23.
So then what would make you get the vaccine? Let's walk in from the other point. What would say, all right, I'm going to get this vaccine?
I don't know, to be honest. I don't know. But I've heard, I had a coworker that said if they told him he can't fly anywhere until he get the vaccine, he said
he just go quit?
No, he's number one in line. Like, he's number one in line. He's going to get the vaccine. But it's like outside of that, if he's not like diving full in for it. But if they restricting something he enjoys, then it's like he's going to get it. So I'm thinking like, well, dang, like, so if they say, I'm going to take your computer away,
Oh, I'm fighting by if they do that. Like
would I jump to it? But I don't know. So I can't really speak on what will make me get it necessarily. I honestly haven't really thought that much into it to just now.
Yeah. And so I was like, most people are just like, no, but I'm like, all right, let's think, what would make you do it? So they have to take something, they have to be like, all right, no more travel for people who don't have it. No more working at XYZ jobs unless you get it. Like what's the line where you're like, all right, I guess I have to. Okay. Or does it exist?
I don't think it exists for me. I think I have to actually see, or take some time to actually see how the results and everything does with the testing. I mean, I don't know, it seems kind of fast for the vaccine and stuff to come in place for something that people still don't understand and still evolving. So you mean to tell me I take one shot and I'm gonna be A-okay? You can tell me that in the future?
It's dose.
It's two.
No. Regardless of how many shots it is, I'm just saying the fact is you can't tell me that down the line I'm not gonna get sick by something else through this, another you say like another part of this virus or something,
if it evolves,
another strand. Another strand or something. You can't tell me that because nobody really knows. So, and the fact that it came from a Trump administration that
yeah, that's the problem.
Not even gonna go through that.
That's why a lot of people don't want to get it, because the current administration that we have was just touting all this nonsense and denying science and all that. So then when they're like, hey, this vaccine is coming out like near Christmas time, everyone's like, that's too fast to get a vaccine now. That's not accurate. There's no way it can come out this fast. But you also got to think, we have advanced so much in science and technology that it is possible for a vaccine to come out before the year ends.
That's not the problem I have. It's the fact that they don't follow their own rules that they give us the mask and all the other stuff. So I'm supposed to, I don't know, it's just like the credibility is shot with me. A lot of stuff in history, like Black history that we have overcome over time, a lot of that is in the back of people's heads. The fact that, it's hard for us to get Medicare and all this other stuff, but for whatever reason, it's easy for us to get this shot. I don't know, it just plays.
So
like
are you
back your head. I'm not getting it.
So okay, what he just said, I remember I saw a post. I think I sent the meme in the group chat one day where it was like, okay, you still haven't found a cure for AIDS. You still haven't found a cure for cancer, but you found a cure for a vaccine for COVID in a year or however what a time frame it is. And so I think me and Alex was discussing, like, you can't really put a timetable on that. I mean, obviously there's other implications, and I'm not even gonna go down that rabbit hole of vaccinations for other diseases or whatever, but it's you reminded me, because there's a lot of fake woke people. Not saying you're fake woke, James. I'm just saying,
I know
like,
you're saying.
There's other people, they're like, oh, this vaccine is a way for people to do X, Y, Z. And it's like, so in that, like, back to what Alex said, like, okay, for those fake woke people, what if they told you, oh, you can't, like you said, you can't get a job unless you get this vaccine. So you're just gonna be jobless?
Yeah, or schools. I mean, the easiest thing to attack is schools. Like, everyone's been through it, like your Hep A/B shots, your tetanus shot, all those things in elementary.
Yeah.
There's nothing to say they can't add this on and say, all right, first year's enrollment of 2021, if these children don't have their COVID shot, they can't be enrolled.
Yep.
Yeah, then what? Then what you gonna do?
Religious exclusion, clearly. I mean, that's the answer to everything. You just claim your religion doesn't believe in it. Then
Exactly.
So I guess James is anti-vaxxer now.
No, I mean, it's just
no.
No, it's not. No. Like, what I'm saying is, regardless, I don't care if they try to restrict all that. I'll homeschool if I have to. But my thing about it is, if I don't feel comfortable with something, I don't care what you try to restrict me with, what laws or stuff you try to take away from me. If I don't feel comfortable, or if I'm not, I guess I'm not willing to accept the whole thing yet. Like, it just seems too fast to me. I'd rather just wait and see how everything goes and then go into it. I'm not just gonna force it on somebody that doesn't believe in taking it or whatever like that.
What's your waiting time?
Research.
How much time?
Exactly, that's what I'm saying.
In your eyes, Ghost, how much time?
I mean, it's not really about the time. It's about, like what Dante just said. Basically the research. I gotta see. I really want to see how this affects people, because there's a lot of people that's being affected in different kind of ways. There's a lot of there's just situations where somebody may be allergic to this, or it'd be different.
Yeah. I said you don't want to be on a commercial where it's like, did you take the vaccine 8 years ago? You now, you know what I'm saying? Now you
qualify for compensation.
Yeah, you try to qualify for compensation. Like, nobody wants to be in that group of people that qualify for that compensation. So I mean, I can rationalize why.
And I could put it in understanding the gamers could definitely understand me. Is anybody gonna rush it out and get the PS5?
Yeah.
No. What I'm saying is it gonna be the whole world that's waiting? There's some people that'll rather wait for the PS5.
The most part, yeah. That's what you can buy one right now.
No. That's the hypest. What I'm saying,
to correlate a vaccine with a PS5.
You're correlating entertainment to people's lives.
I'm basically saying, with anything, there's always gonna be faults, and there's always gonna be stuff that's still gonna be, this isn't gonna be the final. This isn't gonna be the final vaccine, is what I'm saying. This is
you want the bugs and the kinks to be worked out before.
Yeah. Thank you.
Yeah.
There's gonna be kinks. Mm-hmm. No matter what vaccine you look at, there's always gonna be someone that has an adverse reaction.
He don't want to qualify for compensation.
I'm pretty sure a lot of us already had COVID at one point, or something similar to COVID. Because
you look like that meme with the dude looking to the side.
What I'm saying is because when I had, I get bronchitis every year, right? We all know this. This is a fact. I get bronchitis every year. Well, when COVID first started happening, and this goes into how COVID has affected me, when it first started happening or whatever, everybody at the job was like, you know what? That's why you worry about that? COVID ain't real, blah, 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 whatever. A week goes by, I start getting my symptoms for bronchitis like I usually get every year, you know what I mean? Same time, every year, as soon as I walk in, yo, what's wrong with you? No. Hey, I got this. I'm about to get jumped by a whole bunch of people in the office, because all of a sudden everybody is now afraid, because everybody in the building started getting sick, and they started, seeing the symptoms. But I still have the symptoms for my thing. So I had to go through the whole, I think I was out of work for like 2.5 months based off of something I get every year, right?
Yeah.
So that's all. That's the only thing I'm saying. It's what I'm willing to deal with. Like, just because it's all hyped up now, everything, because like you said, the flu has happened and stuff like this.
Yeah.
I'm willing to wait.
One of the things that we as people took for granted, coughing without being judged, is now like
Oh, I
Yeah,
feel that one.
put your hands up. Put your
Sneezing
hands up.
without being
if you do anything involuntary, like you suspect.
You can get
Or you
arrested for that.
suspect.
You can get
Like
arrested for coughing at somebody.
so, and it's like so now all these businesses have these rules and regulations. You have to wear a mask, and I'm not anti-mask. I mean, if I gotta get a mask to go buy something, then so be it. You know what I mean? I'm not gonna fight against it. It's just like it is what it is. I'm gonna be in the store for like what 10 minutes maybe. I get back in my car, take it off, go home. But now
all day, every day. Soon as I walk outside, all day, every day.
Since you walk out, oh yeah, the trees are just secreting COVID everywhere. Oh, these humans are cutting me down, eh?
So, but yeah, I mean, like you don't. It's so ingrained in us now to wear a mask every time we go outside. It's like I feel like it's like when you go to your car, when you leave out your house, your phone, your keys. And he's like, oh shit, I forgot my mask. You know what I'm saying? So it's like it's so ingrained into us now. Like that's all. I mean, for better or for worse. Yeah, like you used to remember when COVID first came and then somebody coughed and you be like, you got it.
You know, that's what happens now still though.
Yeah, it's like you got it. You definitely. And I'm like, so imagine you just cough because, like you said, you may got bronchitis, and somebody instantly like just blasting you, and you be like, damn. And then it's in your head now. Like, what if I do? Like, oh my god, do I? You know, and it's like,
what am I possibly infected?
Right. And it's just, man, like this is the new norm, probably. More than likely, it seems.
Yeah, everyone always wants to say, no, this is just temporary, just 2 more weeks. It's like, no, guys, this is gonna be here for a while. Stop lying. Like
exactly.
Like I remember in March, you're like, oh, it'll be gone by summer. I'm like, I mean, I doubt it.
Is this how, like
this is not.
I took an infectious disease class. This is not how any of this works.
Like, nah, not the way how we act over here in the West. It's gonna be here for a while.
I mean, it's not like COVID's gonna wait till the summer and be like, all right, I'm out of here, boys. Like, no.
Exactly.
COVID was out here drinking Coronas with the rest of us.
Yeah.
Yeah, it's just like it's gonna be here for a while. It's not. It may be a yearly thing, like the flu, like a COVID season or something like that. If it does die down, who knows? It's like unfortunate. It's just unfortunate that people lost their lives because they had other complications or whatever reason it was. Like that's the most unfortunate part of all of this.
Yeah.
Because I'm not concerned with numbers. Like, you know how in the beginning they were like, oh, X amount of people passed away or got affected in this area. To me, it's just like the point is not. I don't see people as numbers like that in that sense. I just see like there's just lives that's just gone. You know, and it's like people. I don't know if any of y'all have lost anyone, but like I said, like my friend, like he was a good friend. He was good to me, and for him, like it was just like that. And like I was just the shock of it was really really bad.
I haven't lost friends to COVID. I've lost friends to like outside things like gun violence. But I can say seeing somebody who was like my grandfather's age or like my cousin's age or like even my age, like seeing them getting intubated when they stick like the tube down your throat so you can be able to breathe, and seeing them hooked up to like all these IV lines, and then when they decide to crash, it's like you have to give them compressions until they just, flatline. That is very hard to see. So imagine seeing that like every day for 12 hours. And a lot of people, especially like the anti-maskers out here, like, oh, it's not that serious. You don't have to wear a mask. Even if I wear a mask, I'm still going to catch it, And whenever they try to come at me on that kind of stuff, I tell them, keep that same energy when I see you on my unit with a tube down your throat. Just keep that same energy. That's all I'm going to tell you. And it's heartbreaking. Like, and I tell people that all the time. They're like, what's it like working during a pandemic? I'm like, it's the hardest thing you ever will have to do in your life if you have to work in a pandemic, especially in healthcare. This is like the hardest thing you will ever have to do. And if I make it out here and unscathed, like, I'm grateful for that. So
Alex,
it's hard. It really is.
How has COVID affected you?
I was hoping just to slide by this.
No, you wasn't. Because James tried, and when James tried, that put the light on you. Like,
yeah, so it worked for me, not for you. So yeah.
No, we still got
I said my piece. What you think, Alex? What you guys say? Curious.
So I guess the first thing would be COVID started in March.
Yep.
So COVID kickoff started with me losing my dad. Unknown if it was COVID or not. Just he's not here anymore, regardless of the death of it. So COVID started with me losing my father, losing my job, and kind of just staying in the house. Just trying to keep everything else intact to some capacity. So from March, I'd say until maybe July or August is kind of the time frame I needed to kind of like reevaluate everything and get back on my feet. So I didn't really go outside much of anything. Clearly didn't have a job, so I wasn't going outside anyway. And I don't go outside normally. So other than that, and me realizing my regular life is pandemic life, I'm like, oh, this isn't too bad for me. But I watched a lot of other people, how that affected them. Like so many people thrive from being outside, going to social gatherings, throwing events, being at parties. So many businesses rely on foot traffic of different areas. You can never really connect until it's all said and done. So watching the decline of so many businesses across the board was just gut wrenching. I mean, of course, the deaths and the things are like the focal point that matters. But now on top of people losing their life, like actual life, they're also losing their livelihood of what they did that made them happy or what brought them joy or what brought them finances. So I got to kind of watch that happen across the board. I'm more of a business finance major or HR major, actually, to be honest with you. So I've always been watching trends and watching how businesses handle it, some better than others. And being at one company who's consistently scrambling to figure out how we handle this, one of the biggest focal points of something both of you touched upon is that situation where you do have people who come to you and they're clearly not well, but you can't make a distinction if it's COVID or not. So you always have to play the most protective route to protect all of your employees, which is you can't work, you can't be here. How are you going to tell hundreds of your staff go to a doctor if they don't have healthcare insurance and to possibly either get a COVID test and or get cleared to work when they either A, don't have healthcare insurance, B, everyone else in the world is doing it. So you have weeks to months of waiting time periods. 3, these tests have been coming back like ludicrously wrong at many times to a point where they're recommending you getting a test for your test. So it's really difficult to look at it from the individual perspective when you're trying to work at a company and trying to make money, but you're also saying, hey, like I need to protect other people because I don't know what I have. Like no one can self-diagnose themselves when they get sick and say, this is exactly what I have. Because the thing is, in Ghost's situation, yes, it's true he gets bronchitis every year, but what if this is the year he has bronchitis and COVID? And bronchitis is just masking over the COVID because his bronchitis just is worse this year. Like there's no way to say because everything looks like the flu when you're sick. Everything presents like the flu, minus like cancer or some case, things like that. But most general sicknesses look like the flu. COVID also looks like the flu until you get some, extra doctors involved, x-rays, things like that, diagnostic tools that aren't available to people. So as far as that's concerned, though, past July into the position I'm in now, it's hard to look at these decisions making from top down. I kind of am privy to those first before everyone else. And look at these decisions made by, I want to call it the big wig, or what I actually call them at times the echelon, because it's someone up there, but you have no idea who that person is and what they're thinking, unless you're kind of good at piecing together the parts of it. But it's been incredible watching policies be drafted and created and watching the enforcement or lack of enforcement of these policies. Security, for example, like you wouldn't think that security guards would have a really difficult time trying to say, hey, you can't come into this building, but people ignore them all the time and walk in because they need a paycheck to feed their family. So That's how it's affected me.
James.
Well, thanks for watching our podcast, and
I'll be last.
Oh.
I'll be last on this one.
now honestly, I didn't really want to talk about this subject. I kind of know it kind of hit me a little harder. Therapy and all that stuff. It really messed up my recovery, and I kind of gained more and got more depressed and stuff like that. And then my grandmother, at the start, I think in March, she had a stroke, and then dealing with that, not being able to see her for that first. It was like first couple weeks, not being able to see her at all. It was heartbreaking. Having to deal with my grandfather. He also had to go in to the hospital as well. My grandmother had another stroke, so she had two in a span of this whole, COVID thing or whatever like that. He had to go into the hospital, get surgery. It was kind of touch and go for my grandmother for a bit. But, she was able to make it out. And grandfather, he was able to make it out as well. Dealing with working and not catching it and not bringing it back home or bringing it to my grandparents, trying to take care of them. Working at a place that really didn't care about your safety. I literally had a guy who was driving a truck. He was sick, throwing up everything. One guy took him, brought him out or whatever like that. He ended up getting sick, throwing up and stuff like that, diarrhea and all that. They both got sent. They never cleaned that truck, not at all. Had times where you couldn't, if your kid had COVID, they implemented a rule or whatever where you still had to come to work regardless. There's a lot of stuff. I don't want to talk about the company. I don't want to put the company out there or whatever like that. But just a lot. Just the bottom, the number was basically all they really cared about, and that really showed. So just I'm not a paranoid person at all, but this whole I guess this whole thing kind of made me more paranoid. Like I said with the whole bronchitis thing. I know for a fact, Afro, but I know for a fact what I have, like bronchitis and all that stuff. I go through it every time. I know for a fact what it is. I knew if I'd had COVID that it would have made me a lot worse than what actually I went through, which is what I usually go through. But also it's the same thing with like Yori was saying, was basically you get a call for, you get like your regular sickness or whatever, and then you're paranoid that the fact that this could be COVID, and I'm here taking care of my grandmother and trying to help out, that fear of giving it to them or my grandparents, or my parents for that matter. It's just really hard. Ended up going back to therapy hard. It just hit me. One day it just snuck up on me. If I didn't go to therapy, I'm not sure what I would have done, but it made me realize how important it is to keep up with your mental health. I know we had talked about it before, but it's really important that you keep your health up, and before you can even focus on others. We've had a lot of friends of the family pass away from COVID, literally going to the grocery store, coming back. Guy, I think in like 9 days, passed away, and ended up finding out they got it from their grandson. There's been a lot of people that have lost jobs that I've known, playing and stuff like that, lost everything just from COVID. There's a lot of people that I know that, it's been an interesting time. It's like, not being able to do things you used to doing. I still haven't gotten in the pool. That's never gonna happen, no time soon at least. Basically staying inside. But it has shown me that even though there's dark times, or it seems like it can't get any harder, any darker, or there's always a bright side at the end of everything. There's always something that you could find to grab onto. I'm glad that I got you guys as friends, my support system and stuff like that. But a lot of people that are going through some of the things, they don't have stuff like this. And what Heather was telling us before, not being able to talk to your loved ones behind the glass, you got to talk to them through the camera. It's soul breaking. So, but that's what I'm trying to say. It's basically like, this won't break us. It just opens our eyes to a lot of things, as you saw what happened with George Floyd and a lot of other things that happened. A lot of people stood up. A lot of people went out of their houses. This COVID has been a very dark time, but it has also opened our eyes to what's important. And, to a lot of people, like as you can see for the election, a lot of people came out. There's a lot of firsts. There's a lot of people that, came to vote that never voted in their life before, that was in their 60s, 70s, never voted before. So this, there are bright sides to this, So the conversation is continue going. There's things to be done. So yeah, that's kind of just been my life through COVID. Just trying not to break under it. Just trying to do the best I can and focus on what's important. And yeah, that's about it.
Heather.
All right. So COVID is actually what made me wanting to quit healthcare as a whole.
I would imagine.
And for me, so this year I have plans to go see my family because I'm from Delaware originally. I'm not from Virginia. So I had made plans to go see my family. We were going to hang out for the summer, things like that. And I had stacked up money to do this. And then when COVID happened and everything shut down, I had to rethink, how am I going to be able to see my family this year? Because as Alex knows, I like seeing my grandma and I like seeing my grandfather every year. Mm-hmm. So not being able to physically see any of them this year affected me negatively because that was the one thing I looked forward to. I looked forward to going to my grandma's house and, eating her food and, having that big family gathering like we always do when I'm there. I was looking forward to seeing my grandfather at the Veterans Memorial Center and give him updates on everything that was going on in my life and things like that. So not being able to do that because of COVID made me really sad. And it still makes me really sad. Even when I think about it, it's damn, I can't go to Delaware and see my grandma this year like I wanted to. I got to stay down here. But at the same time, I know people that are doing it anyway. They just don't care. They're just well, I'm going to go do it regardless. I don't care, blah, 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 blah. But for me, it's I want to protect my grandmother from catching this because I don't want to see her go like that. I mean, granted, it's going to happen anyway, but I don't want to see her go like that. So if it means I have to stay here until this whole thing passes, so be it. I will bear it. I'm not going to sit here and fuss about it. But like I said, this was the year I was actually just going to quit healthcare because of how they're treating us as a whole. And from a personal standpoint, I actually, a couple months ago, 2 or 3 months ago, I had a friend that died from gun violence. And of course, Alex, he knows how I've been handling that. I'm still handling that to this day. I had 3 people die within weeks of each other from gun violence and drugs and things like that, all in Delaware. And one of my main things was, do I want to make the drive to Delaware to go see them one last time? Or do I stay down here because of COVID? That was a determining factor right there because my whole thing was, well, if I stay down here because of COVID and not see them, as they're getting ready to go, then I'm going to regret the decision of not seeing them for the rest of my life. Versus if I take the chance and then I go, and then when I come back, I get the test and do the quarantine and things like that, I'll at least see them like I want to.
I think people try to, they don't want to see how things has changed. So they try to live some type of normalcy or as close to normalcy as they can. So I think that's probably why they're so careless. They're not thinking of others. They just think about, well, I don't like this. So I like to go. Yeah, I'm going to go do this. But Afro.
What's up?
Welcome.
Yeah.
So, man.
Do you have anything to add to any of this?
How COVID affect?
Yeah.
Yeah. I mean, shoot.
Need to cook the ramen noodles to get your thoughts together.
Like COVID over here was a little bit better than it was in the States. I mean, like
The way it was handled.
yeah, how it was handled in the States was just pure idiotic. Like it was dumb. Over here, like once our cases got to like I think it was maybe 15, 20,000 or something like that, they locked down like one of the areas, like Mabula, the area I'm in. So they literally gated that area off, like you were not able to leave. Um, Around when it got like 30,000, they literally locked down the whole country. Like they did a full 24-hour lockdown. Actually, it wasn't even 24 hours. It was a whole 22-hour lockdown. Like the only places that were open were like the places you can get food, and you can't even like go. You have to call the people and be like, "Hey, I need this, that," and they'll come up and get that. But it got real bad from Mabula because we didn't have we don't have electrical stoves like y'all do over there. We have propane, like gas stoves. So we ran out of propane in Mabula. So it got to the point like, people were just like, people were about to start fighting over some propane.
Yeah.
So
a commodity at that point.
Yeah.
Yeah. So like I had to tell my wife to go get some propane because since she's a female, they give women propane first before they give males. So I was like, hey, can you go get a propane and take the driver with you just in case? And call me if something happens, because if something happens, I'm gonna get down, take out, get dressed, and run downstairs and have to scrap move or have to scrap with.
Listen, we have people here in the States fighting over toilet paper, like
chicken sandwiches. What you talking about? This is before COVID.
Yeah, so like it was really crazy. But the one thing that really impacted me is that it literally paused our process to come back to the States. Like our interview for her fiance visa was in like April, and we didn't do it until October. So, and then now we're about to come back over there now, hopefully, depending on what happens. But how Kuwait was not playing. No, Kuwait is a really strict country. They were not playing with what they were doing with that COVID, because they caught you outside. That's like, hey, you come outside. That's like a 5,000 KD fine, and 1 KD is $3.30. So you do the math. So yeah, like people were just like, even the Americans, they were like, I'm not going outside. And I'm like, oh yeah, you hit your money, you hit them pockets, y'all listen. so it was, but it wasn't as bad. Like we don't have any high cases. Our cases are actually going down. I don't know if people are not reporting it or not, but like going back to work, like they still weren't even playing. Like the military is not playing no games. Like the commander, he was like, look, if you come in a building without a mask on, you're instantly getting terminated and going back home. Military or contractor. Military or contractor. It does not matter. So like we would have like some soldiers come in, we'd be like, hey, yo, put your mask on. They'll have to do it, because if they don't do it, I'll be like, all right, I'll just report you to your commander and you can go home.
Yeah.
So yeah, but the military, they weren't playing either. Even our boss wasn't even playing. Like we have to wear our mask the whole day in the building. Like you do not take it off. If like my director would walk in and you were not wearing your mask, he'd be like, hey man, pack your stuff up. I'd be like, wait, what? He's like, you going home, terminated. Like that's it.
I know it started like in March, but we still figuring it out though.
Yeah.
Any closing remarks?
Y'all need to get your stuff together over there in the States, yo.
I feel like it's always your closing remark.
How to get y'all stuff straight, yo.
All right. I like this one.
Closing remarks. Take care of yourself.
Mm-hmm.
Take care of your friends and family. Stay out of melee range, or as they say, social distance. Stay out of melee range, and yeah, that's kind of it.
Ghost.
Well, that's all.
He's alive.
I know, right? Jeez, that's all that was needed.
Well, that's all. Thank you for listening to us and let us know, what you had to go through, or how COVID has affected you all. And, like, subscribe, hit the button right here, and over here.
It's only down there.
It's down here.
Yeah, it's just
we need one of those. But no, all seriousness, thank you for continuing to watch us, and we're back for season 2, and have a lot of interesting topics. So yeah.
Jay's so excited, so he just
Oh yeah.